Hello, everyone. I'd like to say a few words before turning this over to Jule Noack, who is handling HMEA's response to the COVID-19 pandemic. It goes without saying that these are times of great uncertainty, unprecedented in our history, with so much that is unknown as we experience great loss. The loss of the familiar, routines, predictability that we count on. The unknown creates anxiety with so many questions unanswered. What is known, however, is that we have a powerful mission and are very, very good as an HMEA community at working with and taking care of children, adults, and families. At the same time, we need and will take care of each other and are thinking and problem solving 24 hours a day about our dedicated staff. Our agency is diverse, and staff working in different services may be in different situations regarding their work. I am absolutely sure that we will get through this as a community. On a personal level, I'm sure that you all know about social distancing and hand washing, and we encourage everyone to take this advice very, very seriously. Jule and I have our temperatures taken when we come into the office and are always about 10 feet apart. We decided to do videos on separate iPhones so that we wouldn't touch the same object and could practice social distancing. At the national level and also at the state level, we are following the Families First coronavirus bill and what that might mean for us. And we keep up with Governor Baker's advisories and implement his directives, like closing programs. We are also constantly in touch and getting direction from state agencies like DDS, Mass Health, the Department of Elementary and Secondary Education, and the Department of Health. The Department of Public Health is in the lead. Our deep concern is not only for physical health, but also the emotional health of everyone at HMEA and their families during these uncertain times. Please take a look out for each other and remember that EAP is available for anyone and everyone. Before I turn this over to Jule, who again is leading our COVID-19 response, I would like to remind everyone that although the virus means we must change our personal behavior because we need to stop the spread, 80% of the people who contract COVID-19 have mild flu-like symptoms, and only a small percentage of those tested are hospitalized. On a Sunday call with Dr. Eric Dixon, the CEO of UMass Memorial Healthcare, he mentioned that of the 1,200 tests that had been done by Sunday in central Massachusetts, 10 resulted in hospitalizations. So let's keep that in perspective. Now I'd like to ask Jule to talk about how we, under her leadership, are responding and planning as new details are emerging every day. Thank you.
Thanks, Mike. Hello, everyone. I want to start by saying that I know that these are very challenging times for all of us. Things have changed rapidly over the last 2 weeks and will continue to change in the weeks to come. But I want to reassure you that we will get through this together. I want to let you know that the HMEA leadership team is focusing all our attention and energy at this time on 2 key areas. First, we are making sure that the essential services we offer to individuals and families will continue to be provided in the best and safest way possible. We will do this by following the latest directives, guidelines, and recommendations of government and health officials. Second, we are also working hard to respond to the anticipated short-term and long-term needs of our employees. Governor Baker recently announced a stay-at-home advisory for non-essential employees. While this is not a mandated shelter-in-place order, it is an official request to remain at home unless you are an essential employee or you need food pharmacy supplies, or healthcare services. As a human service provider, HMEA employees are considered essential. We will be providing all employees with a letter stating that your work is recognized as essential by the state. Your supervisor should have a copy of this letter for you. Please keep it with you while you are traveling to and from your workplace, or if traveling for agency business, such as running errands to secure supplies. We recognize that you have a lot of questions about your job, the status and schedules of HMEA programs and services. While we don't have all the answers right now, we hear you. We are listening to your questions and concerns and are doing our very best to provide answers to the best of our ability based on what we know today. We are in the process of developing a list of frequently asked questions, or FAQ sheets, that will be distributed throughout the organization. Last week, the first Human Services FAQ was sent to all of you through your HMEA email account, and it was also posted on the Scoop in ADP. If you don't know how to access the Scoop, please ask your supervisor for assistance. We will continue to send updated FAQ sheets and other information, important communication, and program information to all of you through your HMEA email account, and we will continue to post them on the Scoop. We will also be adding updated information as we receive it to the HMEA website. If you have questions or concerns, please share them with your supervisors. Supervisors will gather and send all employee questions and concerns to the appropriate vice presidents on a daily basis. I assure you that we will respond, but I also ask for your patience at this time. Things are moving very fast, and we just don't have all the answers right now. For many of your questions, we need to wait for additional information and guidance from state government agencies and health officials before we provide you with an accurate response. To help provide answers and solutions as quickly as possible, we have created topic-specific response teams to develop and implement action plans to address the multifaceted nature of HMEA's essential services. Those services include, but are not limited to, 24-hour staff departments, medical and nursing services, family supports, AFC, shared living, applied behavior analysis therapy services for children, autism resource services that outreach to families, clinical supports, employee redeployment, educational services, and ensuring programs have adequate supplies and equipment, and so much more. Throughout the organization, various program teams have quickly responded and adapted their services from in-person or on-site delivery to remote or virtual delivery. This includes family and home visits, telehealth for ABA services for kids, remote clinical services, and meetings with government entities and our various funders. Because of the rapidly changing nature of the COVID-19 situation, the HMEA Executive Response Team is meeting daily to review and monitor statewide information from the Department of Health, Centers for Disease and Control, and the Rural Health Organization, and numerous state funding agencies. Our human resources staff are working nonstop with governmental and state officials gathering information regarding benefits and resources to help our employees. That information will be distributed throughout the organization as we receive it. Also, please remember that HMEA has an employee assistance program that you and anyone in your household can access for support in several areas. If you are unsure how to access those services, please contact our human resources staff. Honestly, we have made mistakes, and we will continue to make mistakes as we navigate these daily new challenges. However, what I have seen within the past week and 2 days is an incredible spirit and unity as employees across this great organization have stepped up and forward to volunteer to do whatever it takes to help the people we support and to continue our mission. I call upon each of you, myself included, to remain calm, optimistic, patient, and to please take every precaution to keep yourself, your family members, co-workers, and those we serve safe and healthy. Together we will get through this.